I think I genuinely had to Google what policy is for the first 2 years in my role of like, okay, but what is policy?
Yeah.
And I mean, I think there's so many aspects to it. I personally define it as action or inaction, right? It's a choice. It's like a decision that you're moving forward with, right? And you're creating guidelines basically of, are we providing resources, services, programs, or are we deciding not to, depending on the population or kind of the current world context. My role is a lot of writing briefing notes. So just a 2-page rundown to inform.
Because you love writing.
I love writing. I know. It's, never in a million years. I always identified as someone that was not a strong writer. So I think it's really neat that you don't have to necessarily think that you have a strong skill set to move into that space.
From PHI Media, I'm Gordon Thane. And joining me for a conversation is the founder of the Canadian Public Health Hub, senior policy analyst at First Nations Health Authority, and one of the world's pickiest eaters, Carly Berge. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Carly, welcome to the Public Health Insight Podcast.
Thank you so much for having me.
What we're going to do, we're going to imagine that there's a car. We're going to both go inside the car. Okay. We're going to power up the Google Maps. Okay. Because you need to know where you're going. You don't know where you're going. You don't know if there's traffic. You don't know if there's detours. You don't know if there's a storm. You don't know what's happening. Highway closures, that's kind of annoying, right? But only this time, we're not going to actually do that. We want to envision your career as a Google map.
Love that.
Okay? So instead of the car thing and driving and getting mad at people, we're going to envision your career as a Google map and actually go back to what you would consider the starting point. A lot of people would say it's around that transition from high school to university, picking that program, and things snowball from there. It might go exactly like what you expected, or a 180 or a 270, however many angles there are out there. And so talk to me about going from high school to doing your bachelor's degree at UBC. Tell me about why you chose the program you chose, and at that time, what was your dream for your career?
Okay. No, I love this. This is something I've been thinking about a lot in terms of my career journey, because I think a lot of people, when they come onto a podcast, they're really showcasing their successes and their accomplishments. But even just reflecting on how I wanted to show up today, I love it when others flip the script and share their failures along the way too. And I feel like my career journey has been a lot of detours. I did not ever think I would land into public health, but I'm so happy that I did. And I think when we share that with other people, it really just makes you feel less alone if maybe things didn't quite work out the way you thought it would the first time. So I picked my Bachelor of Science in General Sciences at UBC Okanagan with the full intention of going the pre-med route and applying to medical school. And I'm still applying to medical school 7 applications later now.
Wow.
So I'm waiting to find out in the next month or so. I've written the MCAT 3 times and been on the wait list the last 2 years. So, I mean, I very much am in the field of public health now, but kind of still on that pre-med path. But of course, those roadblocks and rejection letters really led me onto that. You know, as you said, that metaphor of like this beautiful detour into public health and igniting a whole new passion for me. And so I picked, a Bachelor of Science and really, general sciences so that I could just, I was indecisive and kind of wanted to figure things out, just try things. So I really kind of was led into biology and psychology as the things I found a little bit easier, more intuitive. And I was really just picking classes with the intention of getting good grades, recognizing this was like a stepping stone for my education and career. And I wasn't really ever going to be a scientist in a lab or anything like that.
Right. So you went from there to, so my understanding is you went through that program, and thanks for sharing that you're still on that journey, and best of luck to you on that. I hopefully I get a positive update in the next month or so, like you said.
I hope so too.
And then so it makes sense, like the next question starts to make sense of working in like as a medical office assistant after you finish your first degree, your undergrad. You've been in those types of roles for quite some time. You're in public health now. Your intention was to explore the medical field. Tell us about, like, while we're being open and vulnerable and transparent, like the medical office assistant position. What was that? What's that experience like? What did you learn from that role? And like, was it what you expected it to be? Did it make you want to be a doctor more or less? Tell me a little bit about that.
Yeah, sure. So starting in high school and then throughout my undergrad degree, I worked as an MOA in both a family physician's office, so really focused on family, children, the lifespan of people, and also an obstetrician gynecologist office, so reproductive health and babies, and really just leveraged a family friend that was a physician and she didn't have somebody covering the office one day. And so I just kind of stepped in as secretary and was able to kind of, anytime somebody was out of the office, just fill in a temp position for them. And 100%, it was me just thinking, this would look really good for medical school. And keeping in mind, the admissions committee, because I think all my decision-making up until that point was around that. Living my life and starting my career not based on my own terms and passions, but just hoping I was molding myself into a good applicant, which I don't recommend. But it was really eye-opening. So I worked in the role for 5 years and started to notice a lot of patterns that the women and children that I was supporting in the clinics had just much longer wait lists because there was genuinely fewer resources dedicated to them, less that we know, less research, fewer answers that we could give to our patients because of this. And so I would come home from my job most days just really frustrated, especially it sucks when you're the gatekeeper and you have to tell somebody that, like, I know you're in pain and nobody can see you for a year. Right? Because you're non-urgent, air quotes, non-urgent. And it just broke my heart every time. And especially when the emotions get directed towards you because you have to play that role as that gatekeeper. So I don't know. I just really wanted to do something about it. I wanted to figure out who those decision makers were, who the policy makers were, and try to share the boots on the ground impact that I think they were really missing. And so that's actually what it was, kind of this anger or frustration that really led me into public health of, like, maybe I could be involved with trying to change that in some form.
Interesting. I can relate to that. I worked in pharmacy for a little while as a pharmacy assistant and just started to feel very important job. Pharmacies play an important role in society, but just the frustration around, like, you'd see some really difficult stuff with kids being on different kind of drugs and kind of wondering about family environments and then people, diabetes and asthma and like the environmental conditions, and then you just kind of dispensing medications as sort of, that's your role in the health system, to provide and dispense the treatment. But that just wasn't enough for me at the time. And so I wanted to get a little bit more upstream, as they say,
100%.
and root cause focused. And so that's why I went into public health without really knowing what public health had to offer, but I heard that it was this thing that you could go to do things a bit differently, and then I did it and got surprised by it. So I can definitely relate to your journey there.
Very similar. Yeah, I love that.
So then you kind of alluded to it there. It's interesting that you made that leap from, okay, you're the gatekeeper, perhaps the deliverer of bad news, you're very empathetic, not much you could do, to being, okay, at the systems level, at the policy level, there's something I could do. So why then, you went to do your MPH, so I want to know specifically about why you chose an MPH, because there might be other Masters of Health Administration. There's other ways you could have probably still have gone, but you chose an MPH. And then a specific focus on social policy. So make the two make sense for me.
Yeah, absolutely. I mean, to be honest, so again, I was thinking about the admissions committees. I knew how competitive medical school is, knew I probably wasn't going to get in my first go around. And so I seriously just started looking at master's programs. with, the intention of this is a good stepping stone.
Right.
But I looked at a Master of Public Health because it had the word health in it. And I figured that would teach me things related to medicine. But then as I started to dig into, those applications, and you really got to hone in on the mission and the vision of these programs when you're writing your letter of intent, I started to get really excited. And maybe absolutely it was kind of that naivete of, this sounds like the right path. I'm going to be the one to change that.
Right.
But really, I think that mistake or that kind of ignorance on my part just was very serendipitous of finding this field that now I absolutely love. And I think it's interesting that I hadn't really heard of public health before, because it's huge, right? Like there's so many aspects to it, but I think it was just a really siloed field for me as a science student or a pre-med student. But no, I got selected. I had no clue what I was doing. I loved every aspect of the program and kind of had a couple of areas of concentration to pick. I picked social policy because I really saw it as that tool for change and advocacy of, this is an outlet for my frustrations and my anger. But it was a struggle for me coming from that hard science kind of quantitative research, statistics background. Calculus-based physics was not helping me in the slightest. And I was also not much of a writer. Like I got a C- in English in grade 7 and thought the world was over. And so you have to have these very intriguing arguments and that's what these policy papers are about. And I find it so funny because that's what I do in my day job now. But it took me the full 2 years of the master's to really hone in on those skills, because I don't know, I was the least experienced and the youngest in my cohort for sure. And everyone else I just felt was so smart and so experienced and actually knew what public health was. But yeah, it was just a bit difficult coming from that, reactive approach from clinical experience, and then trying to think about anything remotely creative and proactive of how to support the health system.
Thanks for describing even the context of the cohort that you sat in and components like that. Now, you're going through this program, and I had a similar experience where I didn't have really much expectations. You kind of just learned. And the shift from like biomedical cellular level to we're looking at aggregate level interactions between people, behaviors of people versus behavior of a ribosome or DNA.
Yes, right.
It was interesting though to find the parallels between them, like for Jess, but very different concepts altogether.
Yeah.
You then went through your program, and I think one of the reasons I wanted to bring this part up too is because we're in that season where students are approaching their practicums and for the summer, fall, wherever the case might be. Walk me through that process of how you selected yours and how that kind of came about when you were a student in your MPH.
Sure, yeah. Something that I found interesting with the UVic, University of Victoria MPH program, is that you have to secure it yourself, or at least that was the case back in 2021. And so, and it was, the pandemic had hit, right?
Well, not
but
close, but during COVID.
Exactly. And a lot of public health practitioners and teams turned into contact tracers, which you can't really do a master's culminating project and do 450 hours of work towards something like similar to a thesis, right? And so I think I reached out to probably 50 different organizations, just cold emails of, hey, I need to do 450 hours of free work for someone. Could it be you? And it was hard to get responses because nobody had the capacity to take me on, right? In the end, though, I did get 3 different options. There was a kind of climate research position with the Regional Health Authority here in my hometown, something with a nonprofit also in my hometown supporting homelessness and substance use. And then my third option that actually my program helped me secure, just because it was looking like it was crunch time and maybe I wasn't going to have any options, but it was with the BC Ministry of Health and their early childhood health team. And especially as someone coming in the social policy realm, I thought this would be a really, like as an assistant policy analyst position in the government, I don't know. I just felt like I couldn't beat that, right? It's the regional health authority is lovely, and so is nonprofit. But I had worked in a nonprofit for a little bit, and so I just felt like it was an opportunity I couldn't pass up. But I mean, it was my first ever kind of corporate job, which I, for some reason, didn't realize the government was so much like that, kind of the bureaucracy and the hierarchies and the language that they use. But it teaches you a lot. And I was able to leverage that shortly after into a full-time public health position. But yeah, I really did think that potentially government was somewhere I'd want to see myself in. Especially, that advocacy, that frustration that I had. And I was on the women's maternal and early childhood health team that was rolling out universal contraception. So it was, some of the aspects of when I was a medical office assistant, this was something we needed, right? A lot of my job was spent calling pharmaceutical companies and asking for intrauterine devices, IUDs, for people that couldn't afford it. And wow, now I'm doing that as part of the government. But I found that a lot of the times the policy windows shifted. And so you did all this work in the government. They are some of the hardest working people I've come across. They're starting the workday at 6 a.m., logging off after 10 p.m. You gotta get the urgent speaking notes and slide deck and right to the deputy minister needs it. But then they wouldn't use it 80% of the time. So I appreciate the work that those folks are doing as public servants, but I just knew that I do not have the patience to, especially when you're kind of fueled by that frustration, understanding of the boots on the ground impacts. I don't know. It just was why aren't we doing more for the people that we serve? And I know there's so much to it, but yeah, definitely it was eye-opening. It was somewhere I thought I might land, if not medical school, maybe it's the government and working my way up, but I decided even after 4 months that was not for me.
Okay. That's an interesting reflection, Carly, because I think it's an important point to make for new grads who are going to go out in the world and having realistic expectations about influence. And government, provincial, municipal, local, it's a similar experience where there's windows for stuff. Right. The medical officer of health, whatever level that is, doesn't quite work out. It goes in kind of on the shelf or in the garbage, and kind of
100%.
It comes up again when there's hype or something that happened in the community that warrants that we revisit this, and then it goes through. It's a very cyclical thing, and it can be frustrating at times if you don't feel like things are progressing in the way that you want. So I'm really glad that you flagged that.
Yeah. Thank you.
So now, policy, you're still in the policy realm. So right now you work as a senior policy analyst.
Correct.
What does a policy analyst do for people who don't know? And what do they not do? It's a better way to ask it.
Right. I think I genuinely had to Google what policy is for the first 2 years in my role of okay, what is policy? Yeah. And I mean, I think there's so many aspects to it. I mean, I personally define it as action or inaction, right? It's a choice. It's something that you've decided. It's a decision that you're moving forward with, right? And you're creating guidelines basically of, are we providing resources, services, programs, or are we deciding not to, depending on the population or kind of the current world context. So for me, I mean, my role is a lot of writing briefing notes. So just a 2-page rundown to inform.
Because you love writing.
I love writing. I know. It's, never in a million years. I always identified as someone that was not a strong writer. So I think it's really neat that you don't have to necessarily think that you have a strong skill set to move into that space. But for me, it's really you get 2 pages to be sassy, to use that frustration of, okay, we are letting a population down in some way. And especially for me, working at the First Nations Health Authority there's 54 communities we serve. There's not equitable resource allocation, historical inequities, there's a lack of infrastructure. They're not going to catch up unless the government, be it provincial or federal, provides more resources. And you get to just outline that and be a little sassy of you made these promises. Look in this 2018 statement that the Minister of Health said, right? You made a promise.
Right.
Have those come to fruition? Absolutely not. Because I engaged these chiefs and councils and went to their communities, and that's not the reality of these rural communities. And so really just kind of trying to hold people accountable, show them how they could be doing a little bit more. Like, you need to celebrate the successes too. But yeah, you really just get to do like informing and updating for like important discussions that are happening among the different key players in different organizations, or try to inform a decision of like, here's the options and this would be the one that's the most relevant and supportive of population health. But I really just see it as, okay, here's 2 pages and you've heard it's either your own frustration or the frustrations of others, and turn that into something that's really kind of snappy, that's going to make these executives realize that, okay, yeah, you know what, we said we would do something, it hasn't come true, we'll give a little more resources.
What are some of the types of briefs that you've written, like different topics or different
so I'm in a bit of a lucky position where I'm the only policy role for the whole, like, our region of the organization. So yes, the First Nations Health Authority is 1,000 people, but the interior region of BC, we have a specific branch, there's 100 of us, and I'm the only policy person. And serving 54 First Nations communities, there's a lot of policy barriers that are experienced, right? But it's all of health. So it totally depends on the day. It could be that there was a landslide and health emergency management was not doing so in a culturally safe way, and so we need to let that minister know, actually, it would be really great if you gave resources and we could stand up services that are nation-led, because those populations know how to serve themselves best, instead of strangers coming from a larger community, like from an urban center, and responding. Or maybe it's treatment beds. There's not enough treatment beds for especially youth experiencing substance use. And so it totally depends on the day, and it depends on literally what we hear in the different tables, engagement circles that we sit in. A lot of primary care, data sovereignty, and data governance is another one, which is really challenging.
If you have some at our workplace, that's where we're at. Maybe I'll connect with you on that.
100%.
If there's stuff you can share. We're on that journey ourselves.
Right? And it's especially as someone that is a white settler, it is, there's just so much to learn every day. I'm outside of my comfort zone. There are so many things that I have to appreciate that I don't know, and I have to try to get the answers from, and do so in a good way, right? You're not putting the onus on anybody else to teach you, but I just find it, I think I'm in one of the best kind of policy positions out there of, it is never a dull moment. I have no clue what kind of briefing note I'm going to be asked to write this week. And I might know nothing about the topic, and I'll just have to spend a bit of time with listening to the chiefs or listening to the health directors or some form of leadership to try to better understand what those realities are, and then advocate. Yeah.
Speaking of advocacy and your passion for channeling that frustration for positive change, you did something, or you are and have been doing something a bit atypical that I also can relate to. So I was fascinated by that. You are a board member for 2?
Yes.
2 or
I have, one currently, but I've served on 2 different ones.
You've served on 2.
Yeah.
Can you talk about why you did that and what that experience was like being on board? Because I think this is an important point. Like, for me, when you're going through undergrad and the volunteering looks a bit different in that context. And when you're looking at systems transformation, maybe volunteering in that context, being a part of a board and board governance, it's very, very different from volunteering in a way that you might have been used to.
Yeah.
So can you talk about why you sought out those opportunities, what you learned, what stuck with you the most from those?
100%. Yeah, absolutely. So I did a little stint working at a nonprofit between my BSc and my MPH. And it was, injury prevention programs. So driving and motorcycle lessons for adults, kind of babysitter certifications for children. And as a nonprofit, they had a board full of older men, like most nonprofits. And I let the executive director know that I've been accepted to an MPH and I'm not going to be able to work here anymore, but would you ever consider me one day if I applied to the board? And I was told, no, we would not look at your application. We had all those perspectives and skill sets we need. So thanks, but no thanks.
I don't think I've ever heard an answer like that.
Right?
Ever.
I
Even if it's
know.
true, I've never heard an answer like that before.
Right? At least be a little political with your response. But so I always had it in the back of my head that I'd like to practice leadership at that level, especially if there's spaces of power like this that aren't even considering who might not be part of decision making, right? Like they just don't have any variety or inclusivity in who's in these positions. And I really saw it as very similar to public health of your responsibility as a board member is to ensure that you're receptive to the needs of the populations you serve, right?
Right.
Like that's what we're doing at the end of the day. And I think it's very relevant like that to try to leverage our public health experience into board positions. So I, being vulnerable again and sharing my failures, I applied to quite a few and board positions that is, and I was rejected by all of them because I think it's hard to get experience when you don't already have it.
Right, especially a board is a different ball game.
Tough, right?
Yeah.
So I actually applied to this training program. It's called For a Rise on Boards, which takes young women and gender diverse youth and is really just trying to leverage their voices and disrupt spaces of power because recognizing it's typically older, white, straight men and just one really social location in these spaces. And so I was accepted into that training program, so excited about it. Underwent a year of training in all the aspects that you said that they're challenging. Finances, governance, right? Right? It's a lot. And then I was paired with a nonprofit in my hometown where I got to really practice those skills, where they run literacy programs locally and globally. And I was specifically brought on to try to support decolonizing efforts, kind of using my work experience. And then I was applying actually just to volunteer with the Canadian Association for Global Health. I had finished all my training. I had finished my year-long board placement. And they had a box to check to, like, there's the volunteer aspect of this application, but also to be on the board. And I chuckled to myself. I was like, yeah, you know what? Sure. I will check that checkbox. Why not? Had total imposter syndrome, went through the interview, was so nervous, but I ended up getting it. And so I really think, I highly recommend any youth and especially people in public health to try to get into the spaces because it's, like board governance is, I see it really about similar to the pillars of public health, right? You're meeting the needs of the people you serve. You're going upstream through engagement and practicing inclusive decision making. And I just found it was a really fun kind of side quest that's helped me grow like in my work, in my life. So I highly recommend it to anybody.
And it's awesome that you were on it. It's like, this didn't work. I'm going to do whatever upskilling I can do to the best of my ability. And I'm going to go again.
Yeah.
And yeah, you're definitely right. I try to recommend that as well for someone who is looking for what's next and they have a set of skills that they want to contribute to something bigger than themselves. And so it's a great space to be in. But also when you're in those spaces, you realize, I could totally see how very bad decisions get made. Not that the spaces that you're a part of have made those bad decisions. You could see if so-and-so didn't speak up, or if I didn't speak up,
right?
We could have made a very bad decision here. And so you realize like, oh, is this what happens even in politics? Exactly. And so like, you're right. We definitely need to have these different perspectives in decision-making spaces. Young people, old people, whatever kind of people, because there's something usually missing there, like a blind spot. And you just only hope someone has their rearview mirror to see that blind spot and then can kind of color the conversation, which makes for better decisions. So I'm glad that you mentioned that. I want to bring us to another interesting... No, I was going to say the word quirky because I had a lot of fun with it in the intros, calling you the world's pickiest eater as a child. I just made fun of it.
Love that.
What I'm getting to is you wrote and published a children's book about a year ago. Yes. What is it called? Why did you do it?
Yeah.
What's going on? Walk us through. We did board, we're doing policy, we're doing all kinds of stuff, and then we got a children's book. Where did that come from?
Yeah, honestly, it was a bit of a side quest again for me. I was just feeling really discouraged about not being where I wanted to be in my career, still not getting into medical school. But I had this change in perspective of not caring so much about the end outcome, but finding facets to express my passions, my why. So maybe it's not I'm practicing health as a physician, but maybe I can, be curious and try to fill gaps in the health sector with folks around me. And so I wrote and then self-published a book called
great, by the way.
Charlie's Colourful Plate. Oh, thank you.
Fantastic.
And honestly, I was attending, these power hours hosted by Sujani of the PH Spot. And she put me on the spot because I had my camera on. Where it's just supposed to be a collaborative space to brainstorm a public health initiative. And I don't know why it popped out of my mouth that I was like, I'm going to write a children's book. But she started sharing about a podcast episode she had done with Neil Goldstein, and he wrote Pandemics for Babies, and how he treated it just as a fun knowledge translation exercise, for just trying to make information accessible to a population. And so I just thought that was the neatest reframing, especially I was, as you said, I was a terrible picky eater. I ate the same 3 things on repeat. It was like peanut butter sandwich, apple cut up, no skin, with cinnamon on it. Like, my poor parents had no clue what to do. And there was so many nights where it was like you either eat what's in front of you or you're hungry, and then it was just me crying for like an hour. And so, I grew out of it, thankfully. It took a while, until I was in middle school and put in home ec and had to eat the foods that were put out, that we were making in front of all my peers. But definitely was something I had a lot of shame about. And I don't know, it just wasn't something that I saw represented or talked about. And so I did a bit of research on basically the pediatric nutritional best practices of what I wish little Carly had back in the day. And then I organized it into facts and turned it into a little storyline, hired an illustrator. And then honestly, it was just such a passion project that I finished it in 2 to 3 months. Just because I don't know, I was just wanted that outlet.
Right.
I wanted to get Charlie's story out. Right, exactly. But it was honestly just a really great exercise to lean into those things that I'm excited about, despite the fact that I'm not quite where I want to be. But yeah, just putting yourself out there and seeing what it turns into. And yes, I've, only sold a handful of copies, but it's so fun to put yourself out there and just try something new.
Right.
Even if it's
Imagine
a little scary.
The longer that probably took too, the more doubts, should I bother doing it?
100%.
That stuff creeps in and can get a little bit annoying, bog yourself down. So it's nice to hear that you kept that momentum going, and once you committed to doing it, you did it. It's it is what it is. In a way, though, those are sometimes the best feelings, because partly from even how you describe it, you were doing it for yourself, but also we as humans are unique, but we're very similar to others, and that's why we're able to relate. So you're thinking, this was my unique experience, but it might be relatable to other people.
Yeah.
And so you put it out in the world, and what comes of it. So I'm really glad that you shared that story.
Yeah. And the amount of parents that have come forward and they're like, yes, dinner time is so stressful. I think it's a lot more common than we think, but we're just not talking about it because, I've just had such a lovely response of, it's a big problem in the family, and now there's representation. We can pull out, pull out the book and at the dinner table. It's really sweet.
And it's something you could kind of, and kind of keep it moving. But when I came across it, I always joke around about when I was younger, my dad forcing me to eat tomatoes at the dinner table, and I would just cry. And to this day, I think it's like a subconscious grudge. I will not eat tomatoes. I'll eat ketchup. And it was almost like, you screwed me up with tomatoes. I'm going to
you're
remind you
by them.
every time that you're... And it's not a serious life-changing thing, but imagine that could happen on a bigger scale and really cause more harm, right?
Right.
So,
yeah. Absolutely.
Ready for some rapid fire?
Let's do it.
All right. Welcome to Insight Blitz, a rapid fire segment where I will ask you questions or read some brief statements, and you'll give a brief response. Ready?
Sounds good.
All right. What is a skill that you learned early in your career that you still use and lean on a lot today?
Ooh, the first thing that comes to mind for me is negotiation. Especially, I participated in this Women in Science and Engineering mentorship program when I was in my undergrad, and I am very intimidated. I do not like conflict. And it's something that in quite a few interactions, whether it's in the workplace or it's a volunteer position or it's just like an everyday interaction, that I literally think of those negotiation skills and try to think of the ways to not discount myself, because especially when I don't want there to be conflict, my immediate response is to want to back down. But I think about, okay, how can I try to negotiate my way in this?
Okay, I like that. I really like that one. Okay, an experience or moment in your career that completely changed how you thought about health.
Ooh, that's a tough one. My goodness. I feel like, especially working as a medical office assistant and thinking about the kind of practice that I wanted, right? It was just, I really just saw this as like, this is every day. This is just like a normal interaction that you have when you go to the doctor. But there were so many patients that came to us that had been just talked down to, especially when it came to, obstetrics and gynecology, and the amount of times that people were told that their experience is normal when in fact it wasn't, and it was painful and it warranted, like emergency investigation, but we told them, you're fine, just wait a year to be seen. Like so many people being told to suck it up. And so I think it made me appreciate that not every physician's going to be perfect, right? Especially when you can't understand the lived experience of the patient in front of you. And really just why, we do have to advocate. It's unfortunate. You shouldn't have to advocate for yourself in the healthcare field, but that's a lens that you can kind of combine public health and medicine. But I think all practitioners should realize that there's more than meets the eye, I guess.
Touche. So you're hosting a dinner party with your personal heroes.
Ooh.
Who's at the table? Maybe we'll get your chair and 3 other chairs.
Okay, I love that. Am I allowed to resurrect anybody?
You can push any button and anything
Love
happens.
that. Okay, well, first person I would want, I don't know if this is too sentimental, but my grandmother, my Grammy, she passed away when I was 2 years old. But I have grown up with so many stories of how she was, this really neat lady, kind of paving the way, doing a master's of microbiology back in, the 60s. Just such, such a fascination with science and health, and, would love to talk to her about that because, never really got to have that with her. The next person that comes to mind is Dr. Trevor Hancock. I don't know if you're familiar. He is a retired professor from the University of Victoria. He's always attending the climate change conferences and stuff. He is such a neat guy. He's got a blog that he writes, every couple of weeks. And it's like the first thing I do, when I start my week is read Dr. Trevor Hancock's. He was a physician turned public health practitioner. And so as someone that is trying to figure out ways to blend both, absolutely love his insights. Oh my gosh. And then a third person, hero. That's tough. I don't
TBD?
know. Maybe. I know I
TBD?
want to have something.
I mean, there's something to be said about not playing all your cards at once, because then you might say someone and then,
right.
So it might be good to hold that chair.
Okay, let's do that.
Let's hold that chair.
Sounds good.
If you could wave a magic wand and solve a specific, not all, because you would definitely wave the wand. But if you could solve one from waving that wand, what would that challenge be? If there's a specific issue that you could just snap your finger or wave a wand and it's gone.
That's a tough question. I feel like when I look at the broader social determinants of health, the one that I feel the most passionate about, and so maybe this is kind of the area I'd want to, is adverse childhood experiences. So ACEs, especially having done my practicum in early childhood health, I learned a lot about, things that we don't really think much of. Everyone has a little trauma, but it seriously changes the trajectory of your health and wellness for your whole lifespan. And it could be things you don't even remember, but those adverse experiences in your childhood can dictate the next, 60, 70 years of health. And so I'd say to try to better support children and their health.
That's not a bad shout. A hot take that you have about public health or the work that you do in general?
I think everybody should be able to engage in policy and just have that voice of sassiness and trying to hold people accountable. I really wish we kind of would demystify policy so that anybody, be it youth, be it like you work in public health in a different aspect, we should all be writing, briefing notes or advocacy letters to higher up decision makers. Right. I really think, because I think, even if it goes nowhere, there's the odd chance that it does go somewhere. And so it's a great advocacy tool. Highly recommend.
It's like a self-expression of what you're passionate about.
It is, right? Yeah.
And then knowing the levels, right? Because people always get like, who do I send this to? Who's in the position to do anything about it?
Exactly.
So that's like a basic literacy thing that it should be. Yeah,
100%. Yeah.
We'll finish off with the worst piece of advice you've ever gotten. Not the best, the worst.
Ooh, okay. When I started my first day working in the BC Ministry of Health with my practicum, I was sat down by the executive director, which I thought was lovely. He wanted to meet every single new hire, and he was asking me what I was most excited about. And I said practicing the public health core competencies, and especially advocacy. And he said, advocacy has no space in your job. Oh. No space in the government. That is a bad word. Please I don't want to hear you say that again. You have to be neutral in the government, and you cannot have a preference for the populations you serve. You cannot, be biased in any way. He saw it as so I absolutely vehemently disagree with that. I think there should be lots of advocacy, especially when we are taking that curious lens and thinking about the inequities around us and the populations that are falling through the gaps and people that are being missed out. I think we 100% have a responsibility to practice advocacy, and that it should be a good word in all workplaces.
I don't know if I've ever heard that one before.
It was a strange experience, for sure.
I get the whole, you understand the context, and there's some balancing that you got to do, but finances come number one, population number two. That's interesting.
I don't know.
Fair. That's probably top three in terms of when I ask that question. It's up there for bad ones. So you made that list.
I'm glad to hear it.
That brings us to the end of our Insight Blitz segment. Have I scared you away?
No, that was fun. Thank you.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.